Hello everyone. In our session today, we are going to talk about the difference between PCOD and PCOS. A lot of people don't understand what is the difference. These two ailments are taught interchangeably. PCOD versus PCOS, but there are subtle differences, and we are going to Shikha Prakash is going to talk to us about, join me in 1 second, and what the difference is between PCOD and PCOS. So Shikha Prakash, who's joining me from Fertility of Himalayas, India. She specializes in women conditions. Hello, how are you?
I'm very well. Hi, good evening.
Good evening. I was just talking about that you specializes in women ailments, and we are going to talk about the difference between PCOD and PCOS, which many of us don't understand. So over to you now. Hello, Shikha. I think your network is a little bit getting a bit there. So while we are waiting for her network to stabilize, I don't know if any one of you has any questions on or if you have PCOS versus PCOD. So you can keep your questions ready, because okay, I don't know what happened here. Hopefully Shikha can join us again. I am sorry for all these technical issues. Let's see. Let's wait for a second she can join us. I think let's just wait for 1 second. If there are any questions, or anyone has a PCOD or PCOS, or they want to comment on what the differences are, now is the time, or what you are doing, if you're doing any natural therapies to take care of your PCOD or PCOS. Okay, there she is again. I see her, and I'm going to send the request back to her again, and hopefully this will work now. I don't know what to talk to you all the time, while I'm waiting. So let's see. Oh, okay, there you are. I'm just trying to. I'm not an expert, but I'm trying my best to say. So so let's talk about the difference between PCOD and PCOS. Shikha? You're still having network problems. I think we are having some network issues today. Let's wait for a second. Let's wait for a few seconds, and hopefully she can join. I mean, she is joining us from Fertility of Himalayas, so maybe there are some issues, like there are some network issues that are happening. Okay, there she is. All right.
Yeah.
Can you hear me?
Hi. Yes, I can.
Okay. So let's start with a difference between PCOD and PCOS.
Okay, so last time we did discuss what PCOD exactly is, and how it is becoming really prevalent in today's scenario. And when we actually, when somebody is doubting whether they have PCOS or PCOD, so we all assume that it is just one thing. But it is pretty different, very similar, but still very different. So PCOS is Polycystic Ovarian Syndrome, whereas PCOD is Polycystic Ovarian Disorder. And when we come to, in terms of the differentiation, the major thing is PCOS is a much more critical disorder if compared to PCOD. When we say PCOS, the symptoms of this particular disease are seen in much more younger age, maybe at your early teenage, and much more before your puberty also. And it is a disease where there are multiple cystic changes in your ovaries, and it is more of an endocrinological disorder, and it needs more of medical attention, and there can be much more critical and other chronic diseases related to PCOS. PCOS definitely needs more of medical intervention, more of clinical supervision, whereas PCOD is a disorder which is mostly a hormonal imbalance, mostly seen towards your teenage and adolescence, where young girls have a really bad diet or lifestyle, maybe poor eating habits, poor sleeping schedules, no exercises and all, and they're obese and they have other lifestyle generated issues, so they might develop PCOD. In PCOS, many a time there's absolute or no ovulation and there is absence of your menstrual cycle, slightly irregular. So that is the difference between PCOS and PCOD. Hello?
Yes, yes, I'm here. So the infertility, which one causes infertility? PCOS or PCOD? PCOD, you said a hormonal imbalance, right? That's what, or it's not as, it doesn't require as much medical intervention as PCOS needs, right? That's what you're saying. Oh, I think we're having internet network connections issues again with her. I really apologize. We'll repeat this session if you want. Okay, there I am again. Hopefully she can join us. Let's see. Well, I think what we can do is we can end this session. Okay, let's see. She is, okay. She's trying to join us again. So let's see if she should be able to join us in 1 second, and we'll continue.
Yeah. Am I audible again? Sorry for this. There's some technical glitch today. PCOS is more, it causes more of infertility issues compared to PCOD. And PCOD can be majority of time fixed with your dietary corrections and your lifestyle corrections, whereas PCOS needs regular, interventions through your doctors and all that. But yes, there are high chances of developing infertility because of PCOS.
I see. And then the same tests are there, like diagnosis test?
Yeah, more or less the testing are same. So it is basically your radiological investigation that will tell you what kind of a disease it is, and also your male hormones level, which are higher in your PCOS. So that is one differentiating factor. Apart from this, your insulin sensitivity, so insulin levels, because it is again more of an endocrinological disorder. So these are the changes which are seen in PCOS also. And if we say the prevalence, PCOD is more prevalent than PCOS. So that is also one difference. So majority of people, when they say, okay, oh no, I have PCOS, I think majority of people do have PCOD and not PCOS. So I think PCOD is more prevalent.
But and then PCOD, you said it can be easily corrected with simple lifestyle modifications, right? Like diet, exercise, and
yes.
Not much medical intervention is needed, you said, on PCOD versus
No,
PCOS.
in PCOD, not much of medical intervention. In PCOS, still there are certain medical intervention, which is more of your oral contraceptives and things like that. Sometimes because there's insulin issues, diabetes, so all that is taken care of. In Ayurveda, when we talk about it, maybe in the upcoming session, we'll talk about how Ayurveda can intervene in terms of treatment for PCOS and PCOD. But definitely both the diseases are different.
Oh, yeah. Any comments or any questions from anyone? That we've had a little bit of hiccups in the network connection today, but I see quite a few people have been joining back and forth. You're welcome to ask questions or feedback or comments. Any other points that you'd like to bring on PCOS versus PCOD? We will be talking about Ayurveda in next sessions.
I just think that, as now we are seeing the rising incidence of PCOS and PCOD in today's era. So it is. That is one thing I will repeat in each and every session, because it is post-millennials that we are seeing that there's a sudden spike of such diseases. So there are young girls as young as 8-year-old, 7-year-old when they are having their period starting, and there are very young girls as old as 30 when they achieve their menopause. So a very weird biological age we all are living in, which is very uncertain. So, the women's health is very important for her itself, and then also for the family. So more than your physical health, one should definitely take care of your mental health also. If you think that you have an issue like PCOS or PCOD, because with this disease, it gets you a lot of, emotional turmoil, mental anxiety, depression, things like that. So it's in both the cases that you have all those things, because you might have facial hair growth in both the diseases. So there are a lot of similarities when we say PCOD versus PCOS. So since there are a little bit of difference, but they're yet very similar also. So it is a syndrome and that is a disorder. So that's the only difference. But
Yeah.
a lot of symptoms are very similar between both the diseases.
Okay. All right. Well, thank you so much for this session. And next session, we are going to go into the Ayurveda part of it. And then we're going to go into the prevention and the different things that you can do, simple things, simple tips to prevent PCOS and PCOD. With that, thank you so much, Dr. Shikha, for joining us. We'll see you next week, same time. And any feedback, you're welcome to give us a feedback. With that, I'd like to end the session.